today we are discuss about the biochemical markers in pre-eclampsia. First of all, we will discuss about the pre-eclampsia. Altogether, the wide range of clinical manifestations makes the pre-eclampsia more syndrome-like than the defined disease which complicated clinical diagnosis. The risk factors of pre-eclampsia, premigger, that means first pregnancy, and family history, placental abnormalities, obesity, and pre-existing vascular and thrombophilia. So, etiological and pathological factors for pre-eclampsia: failures of trophoblast, invasion, vascular endothelial damage, and inflammatory mediator cytokines, immunological intolerance between the maternal and fetal tissues, conjugate coagulations and also coagulation abnormalities, increased oxygen free radicals, genetical and preadoptions and polygenic disorders, dietary deficiency or excess. Some physiological factors, some vasodilations, these are the mechanism. We will discuss that. Few biochemical markers have been proven specific and sensitivity as a single markers predict or diagnosis pre-eclampsia. Algorithms also include clinical measurements such as Doppler ultrasound and clinical risk factors to further enhances the prediction rate of a low false positive rate, the prediction rate a low false rate. In this review, most promising individual biochemical markers are described for the both prediction and diagnosis of pre-eclampsia. The biochemical markers are presented in the order they are shown to appear pregnancy, first, second, and third trimester. These are three types of success. Predictions of predictive like biochemical markers like PAPVA and HbF and PP31 and SHIFT and PAGF and cystatin C. These are the biochemical markers. Like pregnancy associated protein A, that is PAPA, pregnancy associated protein A, pregnancy associated protein A. These are the glycoprotein synthesized in the placenta, and the study is biochemical markers pregnancy has been pursued for almost 30 years. And maternal plasma concentration increases through the out pregnancy associated plasma protein A has been associated combination with the B human chorionic gonadotropin, that means B chorionic gonadotropin, BHCG. Nuchal translucency thickness to screen like for trimester like 21, 13 and 18, 11 and 12 weeks of gestation period. In features of normal chromosomes decreased the levels of pregnancy associated protein A in the first trimester have been associated with increases of risk like pre-eclampsia. Also features the small gestational age SGA. Pattern delivery. Pregnancy associated protein has been elevated as a predictive diagnosis biochemical marker for pregnancy as like a pre-eclampsia. But screening performance when used as a single biochemical marker is only 10 to 20% combined with the Doppler ultrasound of pregnancy associated protein, like a powerful predictive biochemical markers of pre-eclampsia of prediction rates like 70% at least, false rates like 5% at the term plasma PBA like concentration being the shown to increase the pregnancy complicated of pre-eclampsia and HLP like, but a concentration is still not predictive. So fetal hemoglobin and alpha-1 macroglobulin, recent reports suggested that free extra fetal hemoglobin like fetal hemoglobin involved in pathogenesis of pre-eclampsia. Further, the heme and radioactive scavenger alpha-1 microglobulin is involved in the physiological defense against the fetal hemoglobin. Their concentration in maternal serum in or plasma can be used as a aerial productive biochemical marker. Increased mRNA levels of hemoglobin, fetal hemoglobin in the placental tissues, the free fetal hemoglobin protein in the placental vascular lumen were described in the woman with pre-eclampsia. Hemoglobin is a highly reactive molecule that capable of damaging and disruption cells like membrane and binds inactive nitric oxide with the vasoconstrictions. As a consequence, it metabolites heme and iron, damage lipids and proteins, and DNA damage directly oxidation or generation of reactive species. Reactive species also sometimes it will be exceptions. Heme is also pro-inflammatory molecules activate the neutrophils. Several hemoglobin detoxification systems have been described in human. Recently, plasma and tissue proteins of 1 macroglobulin was shown to bind, degrade heme, and have radical scavenger properties and protect the cells and tissues against the extra hemoglobin and reactive oxygen species, that is ROS. Alpha-1 microglobulin expressed the liver in placental cell has been shown to be unregulated by the hemoglobin, heme and reactive oxygen species. A pathogenic role of hemoglobin and protective role in alpha-1 microglobulin and pre-eclampsia is supported by the ex vivo placental and perfusion experiments. Studies evaluation maternal serum plasma and concentration of fetal hemoglobin alpha-1 microglobulin as a predictive diagnostic markers for pre-eclampsia have shown promising results. Actually, we are talking about the result like biostatistical appearance like here. In a cohort, 96 patients subsequently developed pre-eclampsia, serum concentration, fetal hemoglobin and alpha-1 microglobulin were significantly increased at 10 to 16 weeks gestation in women WHO subsequently who developed in pre-eclampsia. Plasma concentration, fetal hemoglobin adult were also significantly correlated to maternal blood pressure. Patients with established pre-eclampsia, these markers still need to be valid in large cohorts. Placental proteins like PP13 is the biochemical markers. A membrane, the glycine family produced by the placental trophoblast, and the functions of placental protein 13 is still not clearly understood, but is also involved in the normal placental, and in normal pregnancies serum levels of placental protein 13 slowly rises with the gestational age. Several studies shown that lower serum levels in the first trimester in the pregnancies that subsequently developed pre-eclampsia. As a first trimester screening markers of pre-eclampsia, PP13 shows different prediction rates in the different studies. In two different cohort studies, placental protein 13 levels of what determined at 11 to 13 weeks of gestation stage. Both studies showed that significantly lower first trimester and of PP13 in post placental protein 13 women who later developed pre-eclampsia. When combination serum screening with the Doppler ultrasound and positive index prediction rate increased to 70% at a false positive rate of 10%. So, based on these findings, PP13 was concluded to be reasonable biochemical marker for onset of pattern of pre-eclampsia, but a week of for the pre-eclampsia at term. Finally, what we are talking about, the soluble forms like tyrosine kinase, fumes tyrosine kinase, and also soluble endoglin, the two angiogenesis related factors are particularly well studied soluble forms like tyrosine kinase and soluble vascular endothelial growth factor receptors and soluble endoglin co-receptors and beta and also, but both are elevated in maternal plasma with pre-eclampsia compared to normal pregnancies. Elevated with the soluble frame-like proteins like frame-like thyrokinase occur before the clinical symptoms. The levels of correlates with the times of onset of clinical maintenance of pre-eclampsia, partly with the disease severity. Early onset of pre-eclampsia exhibits the higher levels of soluble forms like thyrokinase, and moreover in the animal experiments on proteinuria and hypertension as well as syndromes were infusion of high levels of soluble forms like tyrosine kinase and endoglin. So as a first trimester screening, the marker of endoglin shows as conflicts results. Usually the combinations of with the Doppler ultrasound with the PF of GF growth factors, like prediction rate for the early onset of pre-eclampsia was 77% and falls with the rate of 5%. So sometime we will show the diagram and schematically when we compare to like the will show schematic picture like any another thing like that placental growth factor placental growth factor also it is systemic thyrokinase, the ratio with the slim like tyrosine kinase 1 well described and they are promising set biochemical markers for prediction of pre-eclampsia. Automated fast analysis of methods have been developed for these proteins, but their role as first trimester markers is not clear. Several studies have shown the predictive power of the placental growth factor and also for tyrosine kinase ratio. So second trimester, the prediction rate is about the 90%. In the recent multiple centers like including the 351 also it is like as a single biochemical markers of placental growth factors has been shown predict 53.5% like pre-eclampsia positive rate 5% and 65% false positive rate and 10% with the first trimester rate. Some metabolism is like we'll talk about the metabolics performing like powerful strategically investigate the metabolites that specific cellular events leaves the behind. Metabolic profiling can be used to reveal the pathological physiological mechanism disease and pre-eclampsia. Recently in studies 60 patients were subsequently developed pre-eclampsia and 60 normal pregnancies and 45 metabolics were shown that to significantly alternated in the first trimester and pregnancies that later in the developed pre-eclampsia. For early and late onset of pre-eclampsia, the predictions of rate was between the 73 and 77%, at least the 10% falls into positive or negative. The findings were validated a cohort 39 patients with subsequently pre-eclampsia matched with the 40 normal pregnancies and interstability 3 out of 40 up to regulated were shown as to be hemoglobin metabolites. Cystatin C is a majorly will some protease and inhibitors widely used the clinician as a sensitive marker of for renal functions and estimations of glomerular rate and maternal plasma levels of cystatin C is increased in women pre-eclampsia studies and demonstrated that levels of cystatin C is reliable diagnostic marker for pre-eclampsia. So increased levels of cystatin C is regulated suggested to that caused by their impaired renal functions and also we can study about the increased placental synthesis and cystatin C is recently suggested that predictive trimester for the marker for pre-eclampsia. However, given the low screening performance of study, cystatin C probably not only clinically useful as a single marker but could be useful in combination with the biochemical markers. Thank you. We will discuss about the pre-eclampsia in biochemical markers like cystatin C and tyrosine kinase and alpha-1 macroglobulin and PPA.